Hi, everybody. It is Thursday, September 8th, 2022. My name's Kim Bergen-Jackson, and I'm the administrator at Oaknoll. This week is obviously my week to tape, and so I'll give you an update for COVID. In Johnson County, the numbers are looking actually better, down to 47 positive cases per day last week, or a total of 328. That surprises me a little bit with the students coming back into town, but that's good news. Hospitalizations are pretty stable. Still about 20 adults hospitalized at the University of Iowa and just a few pediatric patients. So those numbers are staying pretty stable. Let's talk about Oaknoll. As far as I know, Oaknoll does not have any new positive people in independent living. There are no positive residents or staff in assisted living. We do have sporadic staff testing positive in various departments, and so we're monitoring that. And then we've had COVID, we've had an outbreak for a couple weeks in the health center. So the outbreak started in the loft, as you know. If you've been following my notes about that, 11 of the 12 residents upstairs ended up testing positive for COVID. How the last remaining resident in the loft was not positive is a mystery to me, because they're in very close contact with each other up there, and it's really hard to isolate them because of their level of dementia. So I was afraid the loft would probably all be positive if they got positive, and that was correct. Luckily for most people, the symptoms have been very mild, and they will come out of quarantine tomorrow, Friday, which is exciting for everybody. Unfortunately, there were 2 residents in the loft who did not survive the COVID outbreak. We had 2 residents pass away yesterday. Not going to get into the details of exactly what the cause of death was, but there were other mitigating factors. You know, all of us have comorbid conditions going into this pandemic, and we've been very fortunate not to lose anybody until yesterday. But it's very hard news to give you, and I give it to you with a heavy heart. I am grateful that they were here with us, and that they were surrounded by people who care about them. You're going to receive a communication about that, I think, in your mailboxes today. And if you have any questions, feel free to contact me or anybody that you have a relationship with on the staff that you'd like to talk to. But it's just the nature of this virus. The only reason we've done so well is because I think of the mitigation strategies that we've used, and those vaccines and boosters. Naively, I think when we first got vaccinated, we thought we would end COVID. What we really did was end dying from COVID for most people. So the symptoms have really been mild among the residents. Maybe a runny nose, maybe one day of a fever, and fatigue. But most people rebound quickly. So I'm very grateful for that, and I don't want you to think that the vaccines are not working, because they are. So I'm in contact with Walgreens right now. I'm trying to pin them down today to see if I can get the new bivariant vaccine clinic up and running here at Oaknoll. That's my priority this week, to see how soon we can get it done. If you have travel plans coming up, or if you have comorbid conditions that put your immune system at risk, I would schedule a vaccine at Walgreens. They opened up their online appointment times this week, and they are providing those vaccines individually in their Coralville stores. I would recommend you stick with the same one you've been using, and you don't have to wait 90 days if you've had COVID to get vaccinated. You can, but you don't have to. And so that is news from Public Health yesterday. I think that's all I want to say about COVID. Again, if you have any questions, just let me know. The flu vaccine clinic has a date set. It's September 29th here at Oaknoll at this campus, and then at Oaknoll East the following week. You can get a vaccine at either campus. It's not based on where you live. We just wanted to have 2 sites available, and it had to be the next week to accommodate the people giving the vaccines. So Those schedules are set. Look for notes when we get closer about that so that we don't have any influenza. We're pretty good with influenza, knock on wood. The final thing I want to talk about is this week has been rough. In 7 days, we have lost 6 residents in various levels of care for various different reasons. It seems like a lot, but I just want to remind you that we only had 3 people die in the 7 months before that, which is highly unusual. And so we knew there would probably be a point in time when we had more cases than not. It is very sad when we lose a resident at Oaknoll, but it's something that we deal with all the time. And while we honor the life lost, we have to move on. So sometimes people pass away suddenly in their apartment from an injury or an accident or a sudden critical event like a stroke or a heart attack. Sometimes people pass away from long chronic problems that they've been dealing with over a long time, and sometimes people just slowly fade away. The deaths that happened this week were all different reasons, but it weighs heavily on the staff, and I'm sure it weighs heavily on you as you lose your friends. So big virtual hug to everybody out there today. If you're feeling like you would like to talk about losses or grief, we have amazing social workers at Oaknoll. We have 3 of them, but we also have amazing other staff. So if you have a connection to somebody and you need to talk, please feel free to reach out. Again, I'm available via email and telephone. I know it's hard to talk about, but it's important that we deal with our grief and our emotions around that loss. So I'm going to end the video being hopeful that you're all doing well, that you're looking forward to fall and Halloween and pumpkin spice everything. And I will come back to see you in 2 weeks. Thanks for everything. Big heart. See you later.